At this outset, I would like to thank the VRSI team for giving me an opportunity to present this interesting case showing hematocrit sign on Enface image in PEVAC. This was a 68-year-old female patient who came to our OPD with complaints of blurring of vision in her left eye. There were no systemic ailments. Anti-segment examination bilaterally was normal. Right eye fundus was normal. And left eye, we can see that there is a reddish lesion which is noted superior and inferior to the foveal area, and the foveal repudex appears done. The OCT passing through the superior lesion shows intraretinal fluid with a vertically oval lesion with hyperreflectivity within, as shown here. And the left eye and the left eye inferior lesion shows a vertically oval lesion with a hyperreflective wall and hyporeflectivity within, suggestive of aneurysm. We treated this with focal laser. However, during subsequent follow-up, the vision remains stable, but the lesion persisted. This is the OCT scan passing through the superior lesion, and we can see that it is almost same as the previous scan. And that passing through the inferior lesion is same, except for a little bit thickening of the wall, which is seen. This is the FFA ICGA image of the early phase showing two hyperfluorescent lesion corresponding to the lesion what we saw clinically, and the corresponding ICGA image also is seen. In the late phases, there was mild perilesional leak which was noted, and on the ICG we can see that there is hypersynescence corresponding to that area. The octa showing the lesion where you can see there are dilated aneurysmal vessels at that area. So in our case, there are two large aneurysms in the perifoveal region with intraretinal fluid. There is no history of diabetes or hypertension. Fundus fluorescent angiography shows hyperfluorescence with surrounding leakage. ICGA shows hypersenescence of the aneurysms, and the octa shows classical features and also non-responsiveness to the therapy, that is the focal laser. All of this falls in the criteria which was described for PEVAC by Sakuni et al. In their first ever paper on PEVAC. When we look at the closer look of the Enface image of these aneurysm, you can see that in the picture, the blue arrow and the red arrow indicates the aneurysm, and the yellow arrow indicates the cystic fluid containing or the intraretinal fluid space. When you look at the blue arrow lesion, there is hyperreflectivity of the wall, hyporeflectivity superiorly, and hyperreflectivity inferiorly, suggesting a fluid level, which is classically described as the hematocrit sign. Aneurysmal lesions in the retina and the choroidal vasculature, like retinal artery macroaneurysm, polypoidal choroidal vasculopathy, or MACTIL, can show such a feature. These lesions have hyperreflective walls and a clear or a blood-filled lumen. Hematocrit sign in PCV was described on Enface OCT images as a round polyp with blood corpuscles which are sedimented inferiorly, giving rise to a horizontal fluid level within the polyp. In this case, Enface OCT scan shows similar horizontal fluid level within the aneurysmal PEVAC lesion, which is known as the hematocrit sign. And to the best of our knowledge, there is no case report in the literature which shows hematocrit sign in the PEVAC. So that's what makes this case interesting. Once again, I thank you for giving me this opportunity.
Dear Akila, thanks for sharing a very nice case. I just had a few observations. One, I'm not sure if the fundus of the left eye had any subretinal exudation, because I don't think you mentioned it also. Exudation is a very important part of PEVAC, and without it, these would probably be just some asymptomatic lateral disease. And other thing is that whether these OCTs that you are showing are pre-laser or post-laser, it's also something which you can mention. And in fact, you can compare the pre-laser and post-laser OCT if possible. Also, if there's a B-scan with a flow overlay, it will be very important, and especially to know if this hematocrit sign had any relationship with the flow. so that if post-laser the flow was reduced and that's why the hematocrit sign has come, that will give us an indication that this could be a prognostic sign as well. Especially it may explain why the superior macronism had a more obvious hematocrit sign as compared to the inferior one, and whether it had anything to do with the flow of fluid or blood through these lesions. So that's all from my side, and thank you for sharing a nice case.